Welcome to With All Due Respect. This is a podcast for women over 40 who are looking for sane, frank advice about their health and wellness, especially through and after menopause. I'm Amanda Thebe, a personal trainer and nutrition coach, and the author of the best-selling book, Menopausal: How I Learned to Thrive During Menopause and How You Can Too. I'd love you to join me every week as I chew the fat with some fab guests on hot topics that directly impact you. I also know the power of conversation is lost, and there's nothing better than sitting down for a natter with your mate and putting the world to rights. And that's exactly what I'll be doing with this podcast. We'll really get to know my guests, warts and all. I've made it my mission to help you by exploding a few myths and presenting you with plain, simple facts. These inspiring conversations will hopefully empower you to be a healthy, strong, resilient bitch, just like me. Before we get started, don't forget to hit subscribe and leave a review, and then visit me at amandathebe.com. And now let's get started on today's show. Hi, welcome back to With All Due Respect. I'm Amanda Thebe, and today I'm speaking to Dr. Heather Hirsch, who I have been connected with for, I think, about 2, maybe 3 years now. I stumbled upon Heather's work when I was trying to just get the message out to women that there's information that's valid and evidence-based regarding menopause. And Heather had just started a YouTube channel and a podcast at that time. And I really enjoyed listening to it. And I really found that it was just a really well-rounded conversation and with really actionable steps. And I was just checking out Heather's podcast and videos. And I know there's been over 100 podcasts and videos to date, with over 70,000 downloads of the podcast, 200,000 downloads of her YouTube videos. I think you might be over like at 10 or 12,000 followers on YouTube now at the moment, Heather. But I wanted to bring you on the show today to talk about a few things. I know from about 2014, you've been really keen about talking about the education for healthcare professionals with regard to women's health, including menopause. So I want to talk to you about that. I want to talk to you about your upcoming book, Unlocking the Menopause Type. I'm excited to hear about that. So let's just get stuck in. Hello, my friend, and welcome to the show.
I'm so excited to be here.
It's so great. So just before we get started, Heather just had a really cute conversation with her dog. Listen, Zoe, I have to take you downstairs. I'm doing a podcast recording. So the dog understands you do podcast recordings now.
The dog understands. And I think she likes to make some cameos. So we'll see.
Heather, so I think it's been 2 or 3 years now, right? That we've been friends, never met in person, but we constantly talk to each other. I know.
That's crazy. I feel like we've been friends since at least 2017 or 2018 when I was at Ohio State, but the pandemic really blurs the lines.
That's right. When I first met you, you were at Ohio State, and now you're at the Brigham Women's Hospital in Boston, where I had my firstborn, which is our little connection there. And it's one of the first clinics of its kind in North America, right? So can you tell me why you started the clinic, or even just like why you felt like education in women's health field in general needed your injection of like enthusiasm and education?
One of the things people will ask me about, either when they see me in person or sometimes even during interviews, is like, wow, you're relatively young to be interested in menopause. And even worse, you are pregnant. So you are clearly not in menopause. And what I really want to say is that while I was doing my training, I was always interested in women's health. And I started in OBGYN delivering babies. But something still just felt like it wasn't the right fit for me. And through a convoluted path, I ended up doing advanced fellowship training at the Cleveland Clinic from 2014 to 2016. And when I was there, I had my aha moment that healthcare has failed women after they have had children, if they even choose to do so. Because I couldn't believe that women were coming from across the country, across the globe even, to go to Cleveland to get help for this mysterious thing. And for many of them, or almost nearly all of them, it was perimenopause and menopause. At that moment, I realized that's what I want to dedicate my career to. That's what I want to do, because it was such an invisibility that even I, a bona fide feminist, and I was double majored in women's studies and biology in undergrad, and then went to med school and did OB/GYN. Even I didn't think about menopause, and everything I'd learned about it at my seemingly top-notch residencies were wrong and they're not evidence-based. And my passion just grew and grew and grew and grew as I realized how much you could really turn someone's life around at this time. And since then, I've always wanted to do menopause. So then I went to build a menopause clinic at Ohio State and got recruited to build the menopause clinic here in Boston. And it's all just really stemmed from the idea that women's health has been made invisible after a certain age. And we have done significant harm and damage to the most important aspect of society, which is women aged 35 to 65.
So, interestingly, you said then when you were at one of the best sort of like medical facilities in the world, like the Cleveland Clinic, you said that the menopause sort of education and conversation was invalid. It wasn't correct. And I'm really confused by that, because when you look at the North American Menopause Society, there's valid information on there. It's a brilliant resource for women. And so why would somebody like the Cleveland Clinic not use those as a resource? Or I just wonder where the disconnect has happened. And can you explain that to us?
Sure. Well, the Cleveland Clinic is actually where my mentor works, Dr. Thacker, and she is who really helped teach me all of the principles about menopause management that I now know and practice. So really, in retrospect, my training, which was next door at Case Western, was really kind of preaching the same message that does get often told to women. Well, if you really, really need something, if it's really, really, really bad and you've tried all the antidepressants, maybe you can try hormone therapy. And if you do, the teeniest bit for the shortest period of time. And that was really all there was on menopause, not how menopause affects chronic diseases, not how menopause affects sexual health. Just really this message of, if your symptoms are really, really bad and you have to do this one thing, I guess you can. So when I did training at Cleveland Clinic, all of that really did turn upside down. And the reason I think my prior training is that that's really how most places still view menopause management, through this lens of eons ago, potentially really since the last cultural shift in menopause management in the early 2000s, and really hasn't changed very much since then. And at every institution I have gone, I spend my time teaching the other clinicians and anyone else who will listen, of course, about menopause management, about how menopause is not a siloed event, about how menopause affects chronic diseases, certainly about hormone therapy, but also I do a lot of teaching even at the cancer hospitals, menopause management and breast cancer survivors, menopause and young women. Now we have a lot of women getting their ovaries surgically removed for high risk cancers, but don't have cancer. So there's so many varieties, flavors, shapes, kinds, things that surround menopause that are also so ignored. If you even just get past the idea that, okay, you can use hormone therapy, that's actually pretty basic. We're still not even through that.
Nope.
But then you go up you peel the layers of the onion, and there is more and more and more and more.
Yeah, the amount of women that tell me they're going in for a hysterectomy and to have their ovaries removed, and then don't get the conversation with their consultant about what they're going to do when that happens and they go into menopause. To this day, I'm just like, I think women on the ground are now at the situation where we know more than doctors, which is really frustrating. And I'm talking North America here because that's your wheelhouse, but they then have to try and find a valid resource for a medical practitioner who truly is up to date with everything. And so I know that that's what you're trying to do. I know that you're now like, I can be the person that helps doctors understand, because it's not super complicated in the management. It's clearly a unique way for everyone. Not everyone does well on the treatments. There's lots of different permutations. And I know you talk about that all the time. How do you feel like you can be part of making that conversation more accessible? Are we going to have a Heather Hirsch's School of Menopause for them?
Wouldn't that be a great idea? So yeah, your question is like, how do you reconcile that? And that's what I have also been trying to figure out and how I've kind of evolved over time, what I've kind of done is really realize there's two lanes. There's the army of women. And that came to me when I was doing a podcast with Dr. Avram Blooming, who I know you know.
Yep.
And I said, how am I going to change this, Dr. Blooming? And he said, you got to activate your army of women. Okay. So anyways, there's the army of women, which are the women listening to your show and following you on Instagram and on your Facebook, maybe know of me also. And then there's the clinicians, and they're kind of running in two separate lanes. And I have to kind of think of them as parallel, but they're not really. And I almost think that you have to almost activate the army of women enough, on fire enough, make enough noise, ask enough questions, demand more, so that even their doctors with varying levels of degrees of familiarity, knowledge, experience can start to say, okay, I need to look for more. I need more information. I need more CME. I need more grand rounds. I need more courses I can take. So certainly while we're on the clinician side, for example, I'm working on launching an 8-hour CME course at Harvard. And I just got some big grants to do so, called How to Prescribe Hormone Therapy. Now, certainly not everyone needs hormone therapy.
No, but that's amazing, because there's a knowledge gap. I don't ever put any blame on the doctors either. It just isn't there within their schooling, right? And so how do they know what they don't know?
Right. I would say that doctor who you could have met in 2013, had I not gone down this separate path, I would be that doctor. I could be an OBGYN and be that doctor. So trying to educate those clinicians. And then for the army of women, sort of putting out content that they can synthesize, giving them space to talk. I have courses now where you can actually learn exactly what you need. And then I give you all the scripts and the tools of actually how to have an amazing conversation with your doctor. And they've been really successful. So really, I kind of see myself as existing between these two parallel roads of being able to help activate the army of women and encourage and motivate them to as much as I can. Obviously, I can't prescribe for millions of women, and also help these clinicians who they are then going to. Although again, there's going to be different speeds at this. So we might be at a speed where the army of women is a little bit more activated or a little bit more pumped up. Although there's sometimes days, Amanda, where I open up my phone and I think we're right back to the beginning.
Oh, I know. I feel the same way, because I feel similar to you in the way that I feel like a bridge between the two. And we're both coming at from different sides of the bridge. And I think it's like you have to have the education, support and knowledge before you can have the conversation with the doctor who may need the same, right? I do see the grassroots movement is really, really important. I always think that it's important to, like you said, to talk about menopausal from all of the different aspects, because there isn't a one size fits all. You're very much about that. You're like, I look at every person I see as an individual that probably won't look anything like the person I saw before them, right? It's so important.
I have so much fun. And as you know, I am working on a book, and it's funny because when you're doing any type of content, because you do a lot of media, the idea is to really one specific person on one specific point of their journey and really niche down essentially. But we kind of did the opposite. We made this book for like every woman, whether you want diet and recommendations, supplements, herbs, non-hormone therapy, hormone therapy, put all of these things together in like one book. I don't know how I made it out alive, because I really do believe that while my underlying message is probably more women could benefit from hormone therapy than are currently on it, that there are a myriad of ideas and ways and things and different kinds of pieces to the puzzle that are also important. Your personal preferences, your GYN and obstetrical history, your family history, your priorities, all of those things are going to make really a unique combination for you. And then to kind of have you sort of think through and pick, you cannot one size fit all. It really can't. And I'm so impressed we got this into one book.
So who's we? Did you write the book on your own or with somebody else?
We is my writer. So my writer is Stacey Colino, and she's a phenomenal, well-known writer who's done a lot in the health and also midlife space. So I don't think I could have written this book without her There's no way. There's no way. I was
No
going to
way.
say it would have taken me 20, 30 years. But also, it's very interesting when you work with a partner to create a book, because it's almost like she goes in your head and picks things out. It was a horribly painful process, we both probably say. But the end result is just beautiful. And I can't wait for people to get their hands on it. But to your point, I do think that it does become exhausting for consumers and laywomen to kind of feel like they're swinging from one extreme to the other extreme. And that can make people feel as though they either have to be all in or all out, and then just kind of want to just completely give up and stop. And it doesn't have to be like that. You don't have to be all in or all out, one way or the other way. For example, I know your journey really well. You tried like 5 different things, right? And sometimes that's what you do, just to realize that maybe actually you needed some kind of combination or none of those. And all of those are really a part of the process. And for clinicians to have all that knowledge of really going full circle, it's a lot. It could literally be its own fellowship. I did my own fellowship in it. So we got a lot of work to do, but not to say we haven't come really far so far.
Well, I was going to talk about that next, right? So where we've come in these last 3 or 4 years, to me, is a really great progress. Because now, I mean, I see menopause everywhere on social media, on TV, in books. And so we've made massive progress, even though I still hear nobody's talking about menopause. I'm like,
have you just tried hashtag menopause? You'll be overwhelmed.
Yeah, there's plenty of us talking about it. And I really, really like that. I don't always love the direction the conversation goes if it becomes too celebrity-fied, it's like, I think that there's a space for us all. Be careful about the overselling of supplements and products. I always go on about that. It's a bit frustrating. But for the main part, I'm super happy about where we are with the conversation. And I think that there's plenty of resources out there now that a woman can actually feel confident going to a doctor knowing that she's got the facts, right? Because we've all got them on our websites. We've all got literature out there in our books, our podcasts, blogs, videos. I send everyone to Heather's videos. Actually, that's my favorite resource of yours, your YouTube, because they're just like quick, small videos and pieces of information. But when I feel like we've made all this progress, and I have a Facebook group as well, and when I go in that and someone says, so I've just been to my doctor and they've just given me hormone pellets, testosterone pellets, or I've just been to the doctor, I'm really depressed, I don't think this is peri-menopause, so they put me on anti-anxiety medication. I look at things like that and go, we're still having the same conversations we had 4 years ago, 5 years ago. Does that get frustrating for you?
Yeah, of course. Of course. And it comes in waves. And I think because of where you and I sit, and you think of things linear, but people going into menopause or coming into this space are coming in at different stages. And so sometimes you really do feel like I've done like every bit of content I have, and someone will ask you a question that you're like, that's like at the beginning. But because of the content wheel, like they're coming in at a completely different spot. But it does throw you off because you're like, wait, have we come nowhere? And you could tell we just did it ourselves. We're talking in circles. There is so much more out there, and there is still a lot to do. And so I don't want to be the silver lining person to say, but the silver lining is this, because it's probably not my mood today, and often not necessarily my mood, although I know I come off as a very positive person. But it's just that we got to keep our eyes on the prize, which ultimately I think is activating the right army of women. But ultimately, I can only activate them to a certain point. They cannot write their own prescriptions, and they need the advice of clinicians. So if we look at their temperature as a gauge, that's okay. But I actually think looking at clinicians as a gauge, although sometimes seems more down, that is actually kind of where the mark needs to go, because we don't have the same discussion about diabetes management and hypertension management. That's because they have learned it and they know it. And while this may be a far-fetched idea that doctors know about menopause, if they don't, then what's happening, as you know, and as you're seeing, is telemedicine and third-party companies are coming in to be able to take that space or take that and I guess I'll say kindly help those clinicians where they're lacking in that information. Now, as those start to rise, then also that's just going to put the heat on clinicians as well further and further, so that they really do need to understand this better, understand it in the lens of not a siloed event, but as chronic condition or the different ways you can treat it. So I think whenever I get into that mode of, oh my gosh, this person's asking me on TikTok if hormone therapy causes breast cancer. I've done a zillion TikToks about this or a zillion videos about this. I need to realize that I can't use them as the gauge. I can use them as a sense of, for example, then a bunch of people will write back to her, I don't even have to do it. So I'm like, oh, okay. Right. But if we are looking at the gauge of what are guidelines doing, what are national meetings talking about, which is where we really need those doctors to come in and give that advice and let people know what is going on. What is NAMS doing? What is the American College of OBGYNs doing? What about the American College of Cardiology? That can actually be, although again, I'm going to say it's not like we're moving at rapid speed here, but there are things slowly happening, and that is an even better gauge.
Yeah. And I also think if you even just say, I've said that 20,000 times, you can sort of also take some sort of reassurance that, you've had 200,000 plus views of your YouTube. We do know there are people out there that are saying, actually, this is what we know. On my website, I have a list of all my favorite resources. Heather's information is on there if anyone's interested. Just because if you type in something you're not sure about, like breast cancer and HRT, there's a video for that. Compounded hormones, are they safe? There's a video.
There's definitely a video for that. That is like the hill I will probably die on, because that's where we combined physicians unknowing, and then we go into patient harm. And that's where I really feel the most strongly about is patient harm.
Yeah. And actually just talking about that, you were saying there's all the telemedicine services out there. There's a couple that I know that actually connect women to NAMS certified practitioners, but there's some out there that the end goal is a compounded prescription of hormone, and they look the same. And for the general population, looking at these alternatives when their doctor doesn't help them, it can be really frustrating. So thank you for the work that you do there. So I just want to sort of like move a little bit to what I just want to talk to you about testosterone pellets. And the only reason I want to talk to you about that is that you and I keep getting tagged in these videos of this sort of celebrity woman in Texas who openly talks about having testosterone pellets and having them inserted in, and we saw them being inserted. It was so traumatic to see. But what's happened, I've seen over the conversation, is that like just testosterone in general as a conversation piece is now, that's the new black. Testosterone's the new black. So can you quickly give us what's testosterone? Why do we need it? Do we need it? And how should we get it in our body?
What a great question. Testosterone is the new black. I vibe with that. I know exactly what you mean. So I will say in my clinic, probably 20 to 30% of my patients take testosterone. So right off the bat, if I say that, you kind of have this idea that, well, not everyone needs it, right? And so what really, how do we figure out who does need testosterone? Well, right now, what NAMS recommends is it should be used primarily for women who are postmenopausal, who have low testosterone, who have hypoactive sexual desire disorder. That's low libido that is bothersome to people, not just low libido that doesn't bother you. Most women postmenopausally have low testosterone, but not all. So you need really both of those things. And then it's really up to the patient if she wants to try, if she wants to take it. Now, when she does, the way I do this, you have to do it compounded. And this is actually how pellets have come so far, because there is no good alternative to say, well, you can get testosterone for women in a patch at CVS. No, you can't. So you still have to compound it. Now, when I compound it, I use very, very low doses that are daily. So what that means is that there's a lot of control. You don't want that testosterone to go too high. That's the problem with pellets. I always wonder, because I see women every single day, and given the option of being able to undo something, most women absolutely prefer that. Most women don't want something that foreign that they're going to put in their body for 3 months. So it must be out of sheer desperation, and or they're getting influenced by other people who have done it and said, oh, now my husband's so happy. Okay. It's an external thing that they're trying to fix this sex life, most likely, because this amount of testosterone is a male level of testosterone. And I know because I see it every single day when people come to my clinic with levels literally 5, 6, 7 times the normal range for women. All right. So I still have to compound it. And I do that for about 6 to 8 weeks. And if they say, you know what, that didn't really help my libido, I got to tell you, I think it's probably that trust issue. I got to tell you that it's the kid that sleeps in our bed. I got to tell you it's that I do miss it, but it don't really. And the testosterone didn't help. It didn't help. Does it give you energy? Does it help with cognition? Does it help with your mood? I don't know. We don't know.
We don't know. Thank you. We don't know, even though the claims are made at the moment.
We don't know. Yeah. We don't know. I'll have patients come to me, Amanda, and say, I swear my energy's better. And I feel like my sex life's a little bit better. And I'll say, okay, well, it's not going to hurt you. I've checked your levels. Okay. But if my patients say, it didn't really help us much, then I'll say, well, let's stop it. And so that's how about 20 to 30% of my patients who are postmenopausal are on testosterone.
And, in Canada, there is obviously level you can get, but you can get a male gel and they prescribe a dot dose of that. What's really interesting as well is I've tried every hormone therapy out there and none of it worked for me. And I did try testosterone for low libido. And I feel like I tried everything else because it's such a complex topic. You and I have talked about this before. Dr. Kelly Casperson's talked about this at length. It's never just one thing. Testosterone can convert a little bit to estrogen as well, right? You'll probably explain that more. And it sent me into a spiral in depression. And I had the tiniest amount within 2 weeks. I was like, I have to come off again. And I know I hear this all the time, but the problem is I hear women failing at taking it or feeling like they're failing and don't say anything to anybody because they feel like, oh, there's another thing I couldn't do.
That's actually a very true emotion. One that as a physician, I should be on the lookout more for. Is this like failure of treatment? Or again, this like you got to be all in with the hormone therapy or all out. And that doesn't have to be the case. It can be that you trial it. In fact, when I'm putting my patients on hormone therapy, I always say, especially the first time we're meeting, we come up with a plan. I'll say, I just want you to know, we're not going on hormone therapy. We're trialing hormone therapy. And that really helps relieve the pressure because I always say, look, we need to see how your body responds to this. Now, the majority do okay, but not everyone does. And not everyone decides to continue it after that first trial period of months. So you are not alone in that. And yes, testosterone, a couple things, is available in the US as the male version of it, which is called androgel here. But it's definitely an imperfect system. You're using this teeny tiny dab. You don't know how much you're using. And insurance usually also doesn't cover it because insurance doesn't think low libido is a medical necessity for women. So we're kind of in that same loop. But what a good point you really bring up, which is even as a patient feeling like your body is just failing you no matter what you're trying. And I'm sure that's also really frustrating and part of this journey. And I think this overarching message in this episode, which is that not one size fits all. It's just so true. All day, every day, I see patients for menopause, and there is not one thing I give to every patient. There just is not.
And you know what Heather does as well? She's a doctor that heavily promotes lifestyle intervention. That's one of your big pushes, isn't it? People should be exercising more, moving more, strength training for the win, eating a well-balanced diet, managing stress. I know that that's part of your message. And so that's why I really appreciate everything you do. Heather, as we come to the end of the show, I want to know either some words of advice for women who are listening or what you want to see moving forward in this whole menopause sphere that we find ourselves in. So what are your dreams and aspirations, so to speak?
Yes. Okay. My dreams and aspirations, I know exactly what they are. What I want to see, what I hope I can do in my time on this earth is really make a dent in menopause care and management. And through those two parallel roads, but I really got to work a little bit more on the clinician side because folks like you and so many people are really activating the Army of Women, which I love to do on social media. But in my day job, I'm working on clinicians. What I really want to do is help set up systems and protocols and scale the ability to have clinicians take better care of women. That's really what I want to do. And that may mean at some point I can't see patients one-on-one or as much or as I have been, but it means that I need to be able to help not hundreds of thousands of women, but hundreds of millions of women. And that's my goal. And that's crystal clear. What women should do is keep doing all the things that they have been doing. If you're listening to this Amanda's show, you're in that army of women, educating your friends who still think that hormone therapy is bad or that estrogen for the vagina causes breast cancer. Keep doing that because we want to keep that army activated because at any moment we could really need their help, right? Just like women's rights are currently being attacked on the other side of the reproductive cycle and that army of women is ready, we need the same thing. And it is going to happen and it is coming. And as I wrote that book, I'll also leave off with, I did research on every single symptom that you could have. And the two things that always seem to come that will always help your body is exercise and hydration. Everything. So if you also just leave knowing that Dr. Hirsch says exercise for your mental health and drink water for every little thing. Those two things came up again and again and again. It was so interesting. And we all know that, but research really does show that.
Yeah. And like most things you can say, well, actually, if there was more movement exercise there and they were hydrated, so every cell in their body was supported, you could say, well, we'd see improvements, right? Yeah. Great advice to end on. Thank you so much, Heather, I know you've had a busy day today. So thank you for stopping by.
I can always make time for you and menopause.
Yeah. Awesome. And thank you very much to everyone who listened in today. Take care. Bye for now. Thank you so much for listening to the show. If you like what you hear, then why not subscribe to this podcast and leave me a review? You see, when you do this, it helps to raise the profile of my show and attract new listeners. And it also allows me to continue to deliver valuable content with great guests. And in return for you doing that, I will send you my 12-week core-focused program called Abs on Fire as a thank you. Simply drop me an email at amanda@amandathebe.com and I'll wing that your way. Bye.